Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. And welcome back to Magic Pill session. So you all know that in Magic Pill session we are discussing previous year question papers. That is important topic. In that particular important topic, we are scrutinizing the previous year question papers and we are taking the questions and we are discussing with you. Not only are discussing the questions, we are also discussing the important golden point which is related to that question. Okay, so that is the magical session we are discussing for a long period of time. And today the topic what we are going to discuss is phobic disorder. In the last class we have discussed about somatoform disorder, and in the continuation of that today we are going to discuss about phobic disorder. It is also a very important topic. See, most of the exam they will be asking one question from the phobic disorder. So definitely, even though you would have been come across the phobic disorder so many times, still many students are making mistake in the phobic disorder because there are so many phobic disorders. Okay, so as usual, let's start the topic with the simple to complex phobic disorder question so far asked in the exam. With a motivational thought, we can start the session. Before anything else, preparation is the key to success. Okay, so always the preparation, the practice is very, very important before implementing or before facing any kind of examinations. It is not only applicable for examination, even it is applicable for the day-to-day life practices. For example, if you want to attend an interview, that time also the practice is needed. If you want to do some procedures, that time also the practice is needed. If you want to face an exam, even that time you need the preparations. Okay, so with this thought, let's begin the session. The first question what we are going to see in the phobic disorder is, and before going to the topic, as usual, the routine thing, if you like the video, please like it, share it to others also, and subscribe the channel so that it will motivate us to post more and more videos, guys. Okay, fine. So phobia, before talking about the questions, first let's see what is phobia. Okay, so it is a general meaning of the phobia. It is an irrational fear of places, objects and situation. Okay, either we can say it as a places. Okay, for example, if it is a closed space, the person is getting fear whenever facing the closed environment, or if he is going to a unfamiliar situation, suddenly he is getting a fear. Okay, that is called as what? Places. Okay, objects means by seeing some objects, for example by seeing mobile phone, by seeing a laptop, by seeing a pen, by seeing a syringe, by seeing a needle. Okay, that is, these are all the things coming under what? Object. And situation means the patient is going for taking some treatment. Okay, chemotherapy treatment. Okay, so that is one situation, a panicking situation. Okay, the person is going to get some injection, that is also a panicking situations. Okay, so if the patient is having irrational fear on places, object and situation, that is called as what? Phobia. Okay, so let's see the questions so far asked in the exam. So always, you know, how we are discussing the questions, we always go from simple to complex question. The very common simple question first we are going to discuss is fear of going outside to open spaces is called as. Okay, see, repeatedly asked questions or we are discussing. Okay, so the first repeatedly asked question is fear of going outside to open spaces is called as. Okay, so four options they have given here: algophobia, agoraphobia, acrophobia, aquaphobia. Okay, so four options they have given here. So here, this is the direct question. Here there is the key point, that is fear of going outside. Whenever the person is going outside. Okay, so outside means to an unfamiliar situation, going outside the house, going outside the school, going outside the home. So immediately he is getting some fear. Okay, so this situation is called as what? So already we have seen the options, and here the right answer is going to be option B, that is agoraphobia. A-G-O-R-A. Agoraphobia means fear of going outside, okay, to a open spaces. Okay, so let's see the rationale behind each and every option so that it will be giving additional value for this question. Agoraphobia, it is a common type of phobia. That is the first vital point you're supposed to remember. See, in the exam you would have been getting the question which is the common type of phobias. Okay, so among the four types of phobias which is mentioned here, the very common type of phobia is agoraphobia. Please remember that this is the first vital point. So what is agoraphobia? Already we discussed that it is an irrational fear of being in places away from the familiar settings. Okay, away from the familiar setting. If a patient is going to a unfamiliar areas, immediately he is getting some fear and anxiety, irrational fear, that is called as what? Agoraphobia. Okay, so the next important point is algophobia. Okay, it is not algae, it is algophobia. ALGO, algophobia. It is an extreme fear of physical pain. Okay, see, they will be having always having fear about the pain. Okay, if they are going to meet a doctor, so doctor is suddenly prescribing IV cannulation, so he will think that, so definitely pain is going to be there, so he will avoid that situation. Okay, so he will get panic once he hear the word pain. Okay, so algophobia means, on the whole, it is a simple term. It is an extreme fear of physical pain. The next one is acrophobia. Very commonly used term is acrophobia. You all know that it is an intense fear on the height. Whenever they are exposing to a height, for example, the person is going to a hilly station or 10 floor buildings. Okay, so that time they will be having some extreme irrational fear, intense fear. That is called as what? Acrophobia. Okay, the last one is aquaphobia. It is also called as hydrophobia. Okay, in the exam they can ask either aquaphobia or hydrophobia. See, from the name itself we can easily identify. Whenever they are coming across with a water, immediately they will be having what? Fear. Okay, aquaphobia means it is an intense irrational fear of water. Mostly the people used to avoid these situations. Okay, fine. So these are all the four rationals of each and every options. Okay, guys, let's move on to the next question. So this question asked in DSSB exams. This question also related to the previous question only. See, this is how they are asking the question in different patterns. The same question they are asking in different patterns. Okay, so this is a good example of the previous year question. It's a previous year question. What is the answer? Agoraphobia, right? This question also, the answer is going to be agoraphobia, but the way they are asking the question, you have to understand how they are asking the question. The first question, directly they have asked fear of going outside to a open spaces is called as what? That is agoraphobia. But the same answer, but the question is little means scenario based. Okay, so what is the term used to describe an irrational fear? Irrational fear of being in places away from the familiar settings of one's home. Okay, so here also the key point what you supposed to note is being in places away from the familiar setting. So this is the key point. Okay, so if this key point is present, means immediately you can go for the answer, that is agoraphobia. Okay, guys, so let's discuss about because the question and answer both are same for first and second one, but let's discuss about the other options rational also. Okay, so that it will be easy for you to understand. So the first option what I'm going to discuss here is claustrophobia. See, claustrophobia is also a very common question, so many times asked in the exam, same like acrophobia. Okay, so claustrophobia means if the person is exposed to a closed surface. For example, a best example I can give is lift. Okay, the person is standing in the lift and suddenly the lift door is closed. Once the door is closed, immediately he will be having, or the patient will be having, severe fear and anxiety. Okay, so claustrophobia means it is an intense irrational fear of a enclosed spaces. Okay, the second important point is option C, brontophobia. BRONTO, brontophobia. Okay, this brontophobia, it is also called as astrophobia. Okay, I have highlighted here ASTRA, astrophobia. Either in the exam you can get the question with this key point, brontophobia or astrophobia. Okay, so astrophobia or brontophobia both are same. Here the patient will be having fear related to what? Thunder and lightning. During rainy season, this is very common one, right? Thunder and lightning. So if the person is exposed to this thunder and lightning, immediately they will be having irrational fear and anxiety. So this is the key point. So if this key point are there, means immediately you have to think about what? Brontophobia. It is also called as astrophobia. The last one is acrophobia. You know that fear of height. Already we have discussed this point. Okay. The third question is, this question is asked in AIIMS NORCET exams. What is the term coined for circumscribed fear of the discrete object or situation? Okay, the key point what you supposed to note here is circumscribed fear. It is a general term. Circumscribed fear means it is a general term. Okay, so a fear towards a object or a situation. Okay, they specifically doesn't mention only object, only situation. If they are specifically mentioning only situation toward a open space, then we have to think about what? Agoraphobia. If they are specifically mentioning closed space, the fear is towards the closed space, then we can think about what? Claustrophobia. But here they are generally asking situations or objects. If the person is developing fear towards a situation or objects, what is the meaning? What is the fear? What is the name of the fear? Okay, so like that they are generally asking a question. So 4 options they have given here. Ailurophobia, specific phobia, claustrophobia, and hydrophobia. 4 options they have given here. So whenever you come across the questions like this, that is a general question which is stating that circumscribed fear of a discrete object or a situation, immediately you have to think about what? Specific phobia. Okay, what is that? Specific phobia. Clear, guys? Why it is called as what? Specific phobia. See, I have given the rationale. Please listen to the rationale clearly. See, specific phobias are an extreme fear of object or situation. So this is the definition of specific phobia. That's why immediately we have selected the option B. Okay, fine. So let me give some common examples of specific phobia so that it will be easy for you to understand. First, let me tell about the situations, the examples of situation, because specific phobia means 2 things are there: fear about the object or fear about the situations, right? These 2 clumped together, then it is called as what? Specific phobias. So the examples of situation are a person sitting in the aeroplane or driving a vehicle, going to the school. All these situations is creating the fear and anxiety for the patient. Okay, otherwise object means, as I mentioned already, means by seeing the syringe needle, by seeing the stethoscope, by seeing the bike. Okay, bike is also an object, right? So by seeing some particular object, immediately the fear is developing, means that is called as what? Object. Okay, so if the person is developing fear towards situation or object, on the whole it is called as what? Specific phobia. Okay, the next new term what is there in the question is Ailurophobia. Ailurophobia is nothing but it is a persistent and excessive fear on cats. By seeing the cats, the patient will be having so much irrational fear. Okay, that is called as what? Ailurophobia. Okay, so specific phobia means 2 things are there. That is a circumcised fear towards an object or situation. Or ailurophobia means the fear towards a cat. Okay, fine. The next question is gamophobia means. This question has 2 times in the exam, that is RRB and Navodaya exams. Okay, so gamophobia means it is very simple question, direct question. From the image itself, easily you can come to a conclusion what is the meaning of gamophobia. 4 options they have given here: fear of marriage, fear of closed space. Closed space means you have to think about claustrophobia, right? So it is not at all related to this question. And fear of divorce, fear of social isolation. So these are also not related to this question. So gamophobia means what? Option A, that is fear of marriage. What is that? Fear of marriage. Okay, so this question repeatedly asked 2 times in the exams. The next one is irrational and intense fear of traveling. Okay, so while you are traveling or by thinking about your traveling, immediately the patient is getting a fear and anxiety. Okay, so what is that called as? 4 options. This question also asked in Ayush toughness exams. Okay, so here 4 options they have given here. That is agoraphobia. You all know that agoraphobia means it is unfamiliar situation. If the person is experienced, means that is called as agoraphobia. Phodophobia, aerophobia, thanatophobia. These are all the 3 new terms what we are coming across now, right? Let's see what is the answer first. For this question, intense irrational fear about traveling, the right answer is going to be hodophobia. H-O-D-O, hodophobia. Option B is the right one. Okay, during traveling or by thinking about traveling, immediately the patient is getting fear and anxiety. That is called as what? Hodophobia. The third option is aerophobia. From the word itself, it is easy for us to think about traveling, that is in aeroplane. Okay, so aerophobia means while flying. Okay, either it is a aeroplane or it is a helicopter or it's, you are flying in a parachute or a paragliding, whatever it is. During flying, if you are having fear, that time it is called as what? Aerophobia. Okay, the last one is thanatophobia. Thanatophobia, this word is going to relate with the next question what we are going to discuss. I think this is the last question. Okay, fine. So let's see. So thanatophobia, it is also known as what? Death anxiety. Okay, they will be thinking about what? Death or dying process. So this is the key point what you're supposed to remember. If the person is having fear and anxiety whenever they are talking about a death or talking about a dying process, that is called as what? Thanatophobia. Okay, so what are the three new terms we have discussed here? Hodophobia, aerophobia, thanatophobia. Okay, so here you can see while traveling they will be having so much fear. So that time it is called as what? Aerophobia. Traveling in the sense traveling in the flight while flying. Okay, simply in the exam they are mentioning the word traveling means you have to think about odophobia, and if in the exam they are mentioning during flying, that time aerophobia, and thinking about death, that is thanatophobia. Okay, fine. So that is the last question. There are so many phobias, guys. So just I have discussed the common question what they have asked so many times repeatedly in the exam. So those questions I have discussed now. There are so many phobias. Okay, so among the so many phobias, the common type of phobias what you can expect from your exams are mentioned here. Just go through it. Let me discuss one by one. Already we have discussed about acrophobia, that is fear of height. Aerophobia means fear of flying. So electrophobia, that is fear of chickens. Okay, electrophobia, Alektoro. Electrophobia means fear of chickens, and fear of spider means what? Arachnophobia. Okay, fear of spider means arachnophobia, arachnophobia. Okay, you might guess good questions related to this also. Okay, fear of thunder and lightning already we have discussed. There is astrophobia, claustrophobia, many times we have discussed. Cyophobia, that is fear of ice and cold. Okay, so actually we have to pronounce it as cryophobia. We have to pronounce it as what? Cryophobia. Cryophobia means what? Fear of ice or cold. Okay, and the next one is cynophobia, means fear of dogs. Fear of dental procedure means it is called as dentophobia. Most of the people will be having fear of escalators, that is called as what? Escalophobia. You can get questions like this. Okay, fear of public speaking, glossophobia. Fear of blood, very important question. This question also already asked in the exam. Fear of blood, that is hemophobia. Fear of water, already we discussed. Fear of long words, that is you can see here, fear of long words. What type of phobia is this? Sesquipedalophobia. It is also called as hippopotomonstro sesquipedalophobia. Okay, so it is nothing but fear of long words. Whenever they reading a long word, that time they will be having fear and anxiety. Okay, apart from that, you can see here fear of snakes means ophidiophobia. Okay, and what else is important here? Yes, trypanophobia, that is fear of medical procedures that involve the needles. That involves what? Needles. Okay, the last one, this question already asked in the exam, fear of germs or contamination, that is called as what? Mysophobia. Okay, so many phobias are there. Apart from this also there are so many phobias, but still the common phobias what you can expect in the exams in the future, those phobias I have enlisted here. Okay guys, so hope this video would have been very useful for you for your preparation. So if you like the video, please like it, share it, and subscribe the channel. So once again, I'm repeating the same thing. Please subscribe the channel and then watch the video. So many viewers are watching the video without subscribing the channel. If you are subscribing, it will create a motivation for us to post more and more videos, guys. And thank you very much for watching the videos, and all the best for your upcoming examinations. Okay.